Hi, welcome to Healthy Alternatives, where we explore complementary and alternative medicine, as well as other lifestyle choices that promote and enhance human health and well-being. Our guest tonight is Dr. Mark O'Malley, chiropractic, doctor of chiropractic medicine. Mm-hmm. And many of you might be familiar with Dr. O'Malley. He practices right here in Wethersfield on Beaver Road, right?
Yep.
So, before the show, we were talking. I just thought this was interesting. You come from a history of chiropractic medicine. Could you tell us a little bit about your parents?
Sure. Both my mom and dad were chiropractors. They met at chiropractic college, and it was in the middle of the 1950s. They started a practice in New Hampshire. Mm-hmm. Yep. So,
and your mom, you were saying, is in her 80s? She's
mm-hmm. 80? She's 80, and she's still practicing in New Hampshire.
And she's still practicing. So, you know, I got to tell you, if there's any, actual proof about the benefits of chiropractic medicine, you have an 80-year-old chiropractor who's still able to practice. I think that's phenomenal. But, so, Mark, you have the O'Malley Chiropractic Center, and it's really more than you have other people that work with you at the center.
Yes, I do. I have 4 massage therapists, and there's an acupuncturist, Edwin Brown, who also works in the center. Mm-hmm. Yep.
So, now, I think a lot of people are still a little confused about chiropractic. Mm-hmm. You know, we think that it's, I got my back hurts or my hip hurts, and that certainly is a large part of what you do. But there's more to chiropractic than taking care of aches and pains, right?
Correct. And we try to focus on educating the patients into lifestyle changes that are going to be beneficial for them in the long run. Just healthy living. Our focus is not so much in the nutritional aspect, but in the day-to-day body mechanics and exercise and things that they can do to take charge of their own musculoskeletal complaints.
Mm-hmm. Right. So earlier before the show, you were talking about the 4 areas of chiropractic medicine. Could you talk about that a little bit?
There's areas that people can specialize, chiropractic doctors can mm-hmm. specialize. So there's neurology and orthopedics, internal medicine, sports medicine, and nutrition. So if a doctor of chiropractic wants to spend the extra, and it can take 3 to 4 years to complete the training and then sit for a national board exam, then they become specialized in that area.
So just like in allopathic medicine, chiropractic has its specialties.
Yes, board certification.
Yeah, I was totally unaware of that. But your area of expertise is the orthopedic.
Correct.
So we'll probably be focusing on that mostly this evening, mm-hmm. right?
Yep.
So why don't you tell us maybe like a typical encounter or a patient visit and what's involved?
Mm-hmm. Usually somebody will come in with a what we call musculoskeletal complaint, so back pain or neck pain. I'll give you an example. So somebody comes in with neck pain or radiating pain in the upper back, and we try to look at the daily activities or sleeping habitus that may be contributing to that. So we try to get a bead on when the pain is being aggravated. Are they waking up with it in the morning? So maybe it's something having to do with their sleeping posture or their pillow or their mattress.
Or all three.
Or all three. And, how does it change during the day? Does it go away and then build back up as the day goes on? So we're looking at timing of the problem. We also look at what are they doing at work during the day? Is that affecting it? Are their ergonomics set up properly at work? Are they standing? Are they sitting? Are they at a computer where the keyboard is too high, or the monitor, mm-hmm. or the mouse? Are they reaching repetitively? So we try to give them focused, constructive changes that they can be empowered with to change the way they're sleeping or working, so that they can mitigate the day-to-day strain and make them aware of physically how they're feeling and what might be affecting it most.
Right. So it is very mechanical, very biomechanical, isn't it?
It is.
What you do. One of the things that people hear a lot about, Mark, when chiropractic medicine is discussed is that term alignment. You want to talk about that a little bit?
Sure. In the training I had, the focus has not been so much that things are in and out of place, which I think is the old school easy way to describe it.
Okay.
But when joint surfaces get irritated, and our joints are made up of capsules, so you've got two bones coming together and ligament structures around forming a vacuum. So there's a tightly enclosed capsule, and if you imagine on a larger scale your knee, if you were to bang your knee and it gets swollen, what that pressure would feel like. These joints in our spine have similar types of reactions to being irritated. So when they get swollen and irritated, they lock up and they stop moving. And
is that because really the stuff's all jammed up in there?
correct,
Right.
it becomes rigid. So if you banged your knee, swelling, you wouldn't be able to move it completely because things are distended internally, so you've got pressure. So what we try to do is, when it's possible, provide motion there, and there are different ways to provide motion. We can do it with the traditional manual manipulation.
And explain that, Mark, what's involved with that?
We try to determine the direction where the joint is most restricted and apply a force into it, if it can tolerate it, to move or break up the fixation. And that's when people normally hear what we call the audible release, which is that popping sound. And that's really the vacuum in the joint breaking.
Oh, okay.
You can get other popping sounds at other times it's not really taking place in the joint capsule, but when tendons rub over each other,
Oh, yes.
some tendons are tighter than others, and it'll create that cracking or popping, gristly kind of sound.
Yes.
And that's not the same thing. It's an indicator that one tendon is tighter than another, and there's a friction rub taking place
Oh, so that's
there.
why when I go like this, I hear those sounds in my
Correct.
eek. Okay, so so is that like when we crack our knuckles?
Yeah, that would be a
That's a
category.
good kind of and some people seem to have more problems with that. Like, I remember growing up, all my friends could crack their knuckles, and I could never do it. And then I'm finding probably it's good to not be able to do all that, huh?
If we walked on our hands, it probably wouldn't be a good idea to do that because that popping and cracking would lead to instability of the joints.
Instability, right. So you don't want really that to happen. But if you've got that rigidity, like you were talking about from injury, you really do want to release that.
Correct. And most of the time, some people try to crack their own backs, and what happens is...
That to me was like, don't do this at home, right?
Yes, and the reason behind that is when you try to pop or release a joint, you're going to release the one that is the most freely movable, which is most often not the one that is stuck. So the ones that are least stuck are going to move first, and then if you keep doing it over and over again, because you do get some relief from it, then you create this aberrant system of hypermobility, so too much movement in the areas that are already moving too much, and the ones that are more rigid, they're not going to move when you do it anyway, they're going to stay even more rigid.
Right.
So you're going to create...
Right, because you're hyper ventilating or whatever, those other joints, compensating for the one that's not moving. So now, could you maybe, to be perfectly honest with you, Mark, it sounds a little scary. You know, you've got this ache, and probably the last thing you want to do is have somebody apply pressure on a joint that's hurting, right? And as a matter of fact, when I talk to people about chiropractic, that's the number one concern. So maybe you could explain a little bit the education that you receive and where you went to school, and so you really, chiropractors are highly trained in human physiology and anatomy. right?
Correct. Yep. My training, I went for 4 years in undergrad at pre-med at St. Anselm College in New Hampshire.
So you do, is that the typical thing? You do a pre-med curriculum?
The standard is not that.
Okay.
Although a lot of us do have that background, and in fact, a lot of people in my class, and we're talking 25 years ago when I went to chiropractic college, already had bachelor's and master's degrees and some PhDs. So, you know, the grouping of people in school already are probably going to be more than the basic. But the requirements are, I believe that they're the same today. I don't know if the 4 years is required, but when I went to school, 3 years was required. And then the college itself was 10 trimesters. I believe one's able to finish school in just under 4 years.
So that's a lot of class time.
Sure.
And I'm sure lab, and do you work on each other, like in chiropractic school, practice and on other students?
Yes.
And then you get people coming in, I guess, to clinic kind of thing?
Correct. And we had quite a bit of anatomy and physiology cadaver labs for multiple semesters. But the clinical part of it, there is an outpatient clinic that we did practical work for the last, I believe it was 4 semesters of school.
Wow, so
I
you
think
got a
we
lot of
started-
hands-on experience by the time you're ready to put your shingle out.
Sure, and board certification. So there's national board examinations that you must pass before you can submit to practice in a state, and you have to pass that state's board exam before you can practice in that state. So you have to pass all of the national board exams, and then each state that you want to practice in, you have to pass their specific examination.
So that seems like, is that a more rigid standard than allopaths? And do they have to take a national test?
I'm not sure what their requirements
Yeah.
are. I think that they're regional, like
okay.
Eastern Seaboard, you know, that kind of thing. But they have their board exams, which I'm sure are very rigorous.
Right. So it really, as far as your part of the chiropractic spectrum, it's all about the joints and the ligaments and the tendons. Do you want to talk about that a little bit?
Sure. In what aspect of that are you interested?
Well, just care of. I mean, you know, I think most people are unaware of what their bodies look like inside and how things are connected and held together. So maybe you could help educate us a little bit about why we should do and not do certain things to, you know, help preserve our basic structure.
Certainly. And our joint capsules are, they don't have direct blood supply. So often we think, you know, if you were to cut into a muscle, you know it's going to bleed, and we often see this. But a joint capsule doesn't have any direct blood supply. So if you were to cut into a joint, and if you imagine a turkey leg attached to the thigh, when you separate it, there's that white shiny part.
Yeah.
And the other white and yellow material around it, which is ligamentous in nature. And as you cut into it, there wouldn't be any bleeding. There's no blood. And this is one of the issues is because they don't get direct blood supply, if there's no movement, the nutrients that we need to get into the joint will stop perfusing or getting into the joint.
I think could you repeat that, Mark? Because I think that's really important, especially when one injures a joint. This is the exact time that you're going to need blood supply.
Correct.
Right? So the joint itself has no blood supply.
Yes, and most people do not know that. I did not know that before I went to school myself. So this is the reason why trauma initiates the osteoarthritic process. So for example, somebody has a whiplash type of injury. You know, the head goes forward and back, and then their neck is very stiff for a long time after that. And they may get some movement back, but if they don't have any type of physical therapy or manipulation or nothing is done to restore function and movement of the joints, what happens is the nutrients that need to get into the joints stop getting in at the rate that they were getting in before, and they start to wear. And that's what becomes osteoarthritis. So use it or lose it is the key here. If you don't get motion back, then, and the sooner the better, then things are going to start to degenerate and disintegrate and turn into osteoarthritis.
Osteoarthritis. And just if you could maybe explain osteoarthritis, like what's happening there? It's a buildup of something in the joint.
Sure, it's the surface of our joints is covered with this, what we call a synovial membrane. So it's that really slippery part of the surface of the joint that allows free motion. And
So it's like the lubricant.
Exactly. And when they talk about it,
Or the gasket or something like that.
Yes.
Right.
And if you talk about the surface or what we call coefficient of friction, if you imagine ice rubbing on ice, how smooth that would be, very little friction, that's the way our joints are originally when we're formed and in our younger years. But once degenerative changes start, they start to become less smooth and more gritty. And I wouldn't equate it to sandpaper, but when these surfaces start to infiltrate with calcium, which is what happens in the degenerative process, and get thinner, and you heard the term bone on bone, which is that rubbing friction, which sounds very painful, and it is, then you wind up causing inflammation with motion. So by that point, if you're trying to reintroduce motion and the joint's too far gone, there's only so far you can go before you'll cause inflammation.
Really, so once that joint becomes totally deficient of that synovial membrane, what are people's options, Mark?
Well, there's chronic pain. So, there are things like applying heat to the area, sometimes tractioning the joint, small amounts of movement, but within a non-painful range, and trying to slow the process down. So there are some supplements on the market. They've done a lot of research on the knees. Glucosamine sulfate helps to increase the matrix, what we call the fibrous part of the synovial membrane, supposing that you have some left. And there are other products. They don't feel that the chondroitin is as well absorbed into the body or utilized, but some studies feel that it does make some difference in the sponginess in the joint, that more gelatinous property. And these in the past, people have talked about taking Knox gelatin for growing stronger fingernails.
Yes, and that did not seem to work for me in high school, Mark, I have to tell you.
So whether or not that's a piece of it, the feeling is that it may be helpful. So they combine the two in one product, and there are a lot of products on the market.
And a lot of times it's the combination. You just can't take one thing. These things work together somewhat synergistically and to manufacture what it is your body needs. And is there any research on the horizon of other substances like the microalgae and other food sources that could be beneficial for people who have compromised joints that you know of?
A big part of it is they feel that the inflammatory part of it is a big piece, and
And the inflammatory part is a big piece. Why? Because of pain, or does the inflammation actually even degrade that area that's deficient even more?
it's a combination of both. So
Okay.
if you have more chemicals in your system that make you more prone to inflammation. So we're talking about saturated fatty acids. So those great things that they make our cookies with, that are loaded with hydrogenated oils that taste so good. Those fuel the inflammatory process, and there's that part of the cell, the cytokinins, that cause the inflammation to increase in our cells and in the joint. So without getting into that too far, lowering those things in our diet help. There are things like the fish oils, the omega-3 and 6 fish oils that help to keep the inflammation down as well.
Right.
And these all make our joints healthier because you're A, reducing the fuel, and B, taking things that keep inflammation down.
Right.
So it's
So you're attacking it from both ends because, there might not be much you can do to replace it, but you can head it off at the pass, any more degrading of it.
slow the process down.
And, isn't it amazing, you're sitting here talking about this and, how as we get older, we're inclined to wear out. I mean, that's aging, as we all know. And, we take our cars in to get checked out, right? And we rarely, I think when people go to the doctors, they're looking at other things. They're not necessarily checking these parameters of joint wear and tear until there's the big blowout, right?
Correct.
So that's really kind of, I think, one of the more important things that, with alternative and complementary, and now you would call chiropractic what? Complementary or alternative? Or both? Or neither?
Yeah, I really...
You're its own thing.
It's really perception, people are going to use it as however they want to. I think that, we're more a part of mainstream medicine than we used to be. I still think that we'd be considered complementary. Yep.
Complementary. So now, do you work with or get referrals from orthopedic surgeons, or you might refer your patients to some? Because this is an example of like that partnership, between allopathic and non-allopathic.
Correct, and there's a much greater, I think, focus on the general well-being of the patient. So everybody's working closer together, and I do a lot of referring out. There are some things that I can't fix, and I'll be the first to tell somebody if they need to see an orthopedist.
Absolutely, and I think that's one of the other misconceptions about chiropractic, Marcus. People think, they're just going to want me to keep coming back. And really, you people are professionals who care about your patient's well-being, and you're there to diagnose and process their injury if you can, and say, hey, look, we can't fix it at this shop, right?
Correct.
Right.
In fact, the model that we're supposed to follow, and most of us do, are if your treatment is not showing improvement within a few weeks, then you reassess, see if there's something else you can offer. But if what you have to offer cannot improve the function or restore what the patient needs, then the onus is on you to refer that patient to whatever other type of health practitioner can. So maybe your office is not the stopping point for them. Maybe they need to go somewhere else. Or, in a lot of cases, I see a lot of patients with muscular conditions as well that go in hand with their joint conditions. If massage therapy hasn't helped them out, I will frequently refer them out for what we call a trigger point injection, which is it's a form of cortisone and sometimes with lidocaine to break up the knot in the muscle that's keeping it shortened and allow things to relax and start moving better. So
I'm so sorry to interrupt, Mark. So
Sure.
could you, now you use the term trigger point, which I think maybe some people at home are not familiar. Could you describe what a trigger point is and how it occurs?
Certainly. When a muscle has been overworking, either because, say, that body part is not moving properly, or there was a strain at one point and it never fully recovered, the muscle will build up lactic acid, which is that thing that makes your muscle sore the day after you work out. It'll build up at a rate that's quicker then your bloodstream can move it out. And it starts to pool in the muscle and become hardened. It'll pull some ions in with it, some calcium, magnesium, those kinds of things, and tighten it up. And the longer it's there, the harder it gets, the larger it gets, and the more the muscle is shortened, so that the area will become locked up. And sometimes we can break it up. Sometimes I give them exercises or give them self-work at home with a tennis ball, applying heat, those kinds of things. But if it's not responsive, after a fair amount of time, then we'll add in, say, seeing one of the physiatrists for an injection.
What did you call that, the practitioner? A physiatrist?
Physiatrist, a physical medicine doctor, and usually they specialize in pain management. And in fact, those doctors specialize in what they do. Some give trigger point injections to muscles and offer medications. Other physiatrists do deeper types of injections, like into the facet joints, which, without getting into a lot of detail, sometimes there's nerve pain that come about because the joint is so inflamed that it's pushing into the nerve area. And sometimes that needs cortisone directly to the joint to get the inflammation down. So some conditions are a lot more serious or severe than others, and they need specialized help. So that's when we do the referral.
Okay. So that's like one sort of avenue, like I could see. And would you, so that's like the person comes in kind of broken, let's say, something broke, right? And you really get them on a road to recovery, right? Do you have patients that just come in to, Mark, I'm older and I want to stay active, and I mean, I'm sure you can just by moving someone's joint, and how like, I think sometimes we don't even realize that we're losing range of motion. We don't know what our joints should be, or maybe we're not hearing what you might hear. Is that part of, do you do a lot of that, or is that part of your practice?
That happens as well. So, the people that are stimulated to come in because of wellness or maintenance are, people that might be a little bit more aware of their body, not get to the point where they're, I don't want to call it a horizontal illness, where they're really put down by it, but they're at that point where they want to stay healthy. And we do have those people come in too. That's less common. I think less people are motivated to stay healthy than are people that have a problem and are trying to get it fixed. So, but we do see both.
And hopefully one day that will change, that, we'll be able to, take advantage of these services before we get sick.
Correct.
But then, of course, there's the economic implications of that, which we won't go into tonight. But, I think that is something that people at home, we do need to start thinking about, is that, we have a system of health care that is very good at fixing things that get broken. But there's not a lot of emphasis on maintaining something so it doesn't get broken, or if it does, it's not going to get broken quite so badly, right? Because, it's always more economically feasible to have the latter instead of the former. And in certain areas of health, we see this, and, we get our colonoscopies and our mammograms and our, all these other tests. But yet there's things about, like what you do, there's really no kind of, gee, maybe I really do need to see if my joints are healthy, right? And that really does, that's kind of, for a lot of people, the first stumbling block to overall health. Things start hurting, and then you stop exercising, and, you might start taking painkillers, and then you have all this inflammation, and spreads throughout the body. So, for people that are watching tonight, I think it's something, to think about, really, how we use our services. And now, besides the joint flexibility, and I don't know if this is something that you do, but maybe you could describe to the people at home. You hear about people, and I heard this many years ago. I had a friend who suffered from sinus infections. And she said, well, I'm going to go to my chiropractor. And I'm like, well, what's he going to do with your sinuses? But evidently, she went and he did something and it helped her sinuses. I mean, so this chiropractic, it's not just, it does help your overall health.
Sure, stimulating the nervous system improves the function of those organs that are attached to those nerves. So when, for example, if things are locked up and there is some minor pressure on the nervous system, if you stimulate it by creating some motion, drawing circulation to the area, then the impulse will flow better. So this is the the more philosophical approach, but there are studies that show that stimulation is also, there is an effect.
There is.
So, as time goes on, I think there'll be more studies in that vein, in comparison with drug companies have a lot of money to put into studies, and, because...
and you can't sell range of motion activities.
Correct. So
unless you're making a DVD or something.
As time goes on, I think that there will be, more studies of this nature, but right now, there's just, not enough.
There's not the studies, and that, I always find that so frustrating, Mark. People go, well, there's no study to show blah, 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 and I'm like, well, who's funding the studies?
There are more studies now
that are getting funded.
There. Yeah.
That's good to hear, because, I think that truly is more, just emancipates people better. That should be the goal of health. Now, another thing I heard was, I work with this young guy, and he's got a 2-year-old, and the baby has got the chronic ear infections, right? And somebody said, hey, take him to a chiropractor. What? Have you ever heard of that?
Sure. And the question is, what would we do?
Yeah.
And we've been taught that if you create circulation or stimulate circulation around the lower part of the jaw area, where the that tube that goes from the back of the throat to the ear is.
That famous eustachian tube,
Correct.
which most parents are familiar with who have children with ear infections.
By massaging the area, you can stimulate circulation and create some movement in there. And oftentimes bacteria can get in there and get trapped and not move. And by moving the area, stimulate or draw the body's defense systems to the area as well. So that's the focus there.
So what I'm hearing a lot in our conversation is circulation, which means blood flow, which means nutrients healing.
Correct.
Right. Which is typically now, though, when somebody hurts themselves, the first thing that they say, lay down, be still, and put ice on it. So could you, talk about that a little bit with us?
I think that used to be more the rule, and I think if you look also at the trends in modern medicine today, after somebody has a knee surgery, they put them in a mobilizer. They do put ice on it, but they try to keep the area moving.
Now, why do they put ice on it, though? Because to me, you're putting ice on it, that blood's not going to go there.
Correct. We want to reduce inflammation.
Okay.
Which is
swelling.
Which is swelling and compressing, but we want to keep motion going. So movement has been shown in those cases. People that have a procedure done recover quicker and better if motion is provided early on. So, like in a case where somebody injures their back, simple range of motion within the levels that they can tolerate, and ice would be the focus. But bed rest is something that
We just don't
we
want to
try
do that
avoid.
anymore.
Correct.
Right. And so, I mean, you can still understand, though, why people, when you're hurting, you just don't really want anybody poking at you, right?
Right.
But, so, here's the big million-dollar question. Does it hurt? Like, if I were to come in and I had injured something, my neck or my back, and, you have to touch those areas, right? What level of discomfort are we talking about here, Mark?
So somebody with a new injury, of course, would not have a manipulation.
Okay.
So they'd be evaluated, and it's that same focus. We want to get motion back as soon as possible, but at the same time, we don't want to cause more damage. So I would give people things to do that are exercises,
Okay.
have them apply ice, and have them do things that keep the inflammation down. So they may take over-the-counter things. They may want to increase omega-3 oils,
Okay.
avoid the hydrogenated oils in their diet, those kinds of things. But
So you kind of have a little talking to with these people. Like somebody's going to come in and you really have to tell them, hey, look, here's what you're doing and you got to do. Stop the cookies, eat more sardines, and how does that go over?
give them some suggestions. Lifestyle changes are difficult, so not everybody is going to take everything you tell them to do. But if you can at least empower them a little bit and take the fear away, then it'll help them along. And when they're able to tolerate motion, then we introduce it. So
let's talk about that a little bit. What is that motion? What exactly are you doing? I mean, I'm assuming, of course, depending on the injury. But if, let's say, a lot of people have back problems. And you'll hear that, I have a bulging disc, or my disc slipped, or whatever. Could you, what does that mean, Mark?
So a true disc that is pushing out is usually pressing on a nerve. So there's usually pain in the extremity associated with it, whether it's the arm or the leg, and that's not something we want to be very aggressive with treatment. We want to focus them on tractioning types of activities, so things to decompress the area.
So in other words, stretching?
Stretching, but in a way that takes pressure off. So there are traction units that we suggest that the patient use for their neck or their lower back.
And is that the machine that we see in the office? It looks like a rack.
Yes, that's one way of doing it. And there are things that they can do at home.
Oh, okay.
There are over-the-door traction units that are very inexpensive. There's ones that you can do in the seated position that you pump up. They have a pneumatic pump. For the lower back, sometimes just laying on the floor with your legs up on the sofa, pressing your back down.
I've heard of that, yeah.
So there are a lot of gentle things that can be done at home to help mitigate these problems, but we try to get people on the right path. The discs are made up of fibrocartilage that are in concentric rings. There's 20 rings, and the material in the middle will start to work its way out with tearing, and it's usually shearing forces that create that tearing. You may not feel the disc tearing until it actually gets to the far edge.
No, that's unfortunate.
Correct, and that's the way it is. You may get little warnings, but until it actually bursts out or presses on the nerve, you may not feel much.
What are those warnings, Mark?
Bending and twisting, and
Little
then
twinges, kind of?
your back will seize up.
Oh.
And you may not get leg pain with it, but, for a while, you may not be able to bend or move, maybe a month, where you say, I really hurt my back.
Like a stiffness.
Yeah, and then
Right.
yep, exactly. And then it goes away, but then, you do it again. But usually the flexion or the bending motion and lifting something and twisting with it. So it's that combination of forces that is usually the worst for the disc.
Yeah, it's like a 1, 2, 3. Yeah.
Correct.
Yeah. So once you get the person sort of stabilized and less swollen and inflamed, that's when you can do your work, you and your team,
Correct.
right? And so you mentioned that there's various types of massage earlier. Could you go into a little detail about that?
Sure. Addressing the muscular issues, sometimes areas will tighten up and muscle relaxants may or may not be helpful. And sometimes direct work on the muscle is enough to break up the tension. Sometimes I find that we're able to get better motion after massage therapy is done. So
You might have the massage therapist do something first and then the patient would come and see you?
correct.
Right.
And sometimes they need to do it for a series independently, and then come back and see me after a few weeks.
Oh, okay.
And
So it's kind of a team effort,
correct.
a lot of what you do. So, okay, so now it's time for the patient to come and see you. So what types of, how would you be handling the patient?
So I'm usually assessing what needs to take place. Some people can't tolerate manual manipulation. Either their joints are too sensitive or they're fragile. If they have osteoporosis, I don't want to be doing really aggressive maneuvers with them. So there are other forms of mobility or mobilizing techniques that we can apply to the area. We have a technique that's called, we use a reflex hammer. They call it the activator technique, but we create motion in the joint with this instrument that creates a quick impulse. And because it's very quick, forces mass times acceleration. So we, with that quick acceleration, are able to get the movement in there.
So it's really like an electrical device?
It's more of a spring-loaded instrument.
Oh,
So
okay.
it creates a quick kind of a pop.
Oh,
And there's a system that goes with it, but there are other things that we can incorporate, and I promote a lot of exercise, specific exercise in the practice to help not only restore range of motion, but help to stabilize. So if people become aware of their stabilizing muscles, they're able to take some or create some stability for themselves by, they're empowered to keeping their frame in a better position so that they're not straining as much, they're not getting injured as often, and they have a way to take care of themselves, self-care.
self-care, which really is a lot of chiropractic. And we would like to maybe even see more,
Correct.
right? Well, Mark, it was really very interesting. Is there anything else you'd like to cover that I didn't ask?
I think we've covered it pretty thoroughly. Thank you.
All right, so once again, our guest tonight was Dr. Mark O'Malley, and why don't you give your address and phone number? And
Sure.
do you have a website?
Oh, yes, we do.
Okay.
So it's O'Malley Chiropractic Health Center, and it's at 78 Beaver Road, and the phone number is 860-257-9400. Our website is www.o'malleychiropractic.com. No apostrophe.
No apostrophe. Well, Mark, I'm sitting here, and as I'm turning my head, I'm hearing things in my ear, so I think I might just come in and have an appointment with you. So,
We'd be pleased to take care of it.
well, I'm going to take you up on that, and I think that, before it gets too out of control, consider seeing Mark. Thanks again, Mark.
Thank you.
It's nice talking to you.
Thanks very much.
Thank you.